You're listening to Beyond Wellness Radio, bringing you the cutting edge in health, biohacking, and sports performance. Stay up to date and listen anywhere and anytime on your computer, tablet, or smartphone by subscribing on iTunes. Catch your host, Dr. Justin Marchegiani, as he answers your burning health questions as well as interviews from world-renowned guest experts. For more Beyond Wellness Radio, go to beyondwellnessradio.com.
Hey there, it's Dr. Justin Marchegiani. Welcome to Beyond Wellness Radio. Feel free and head over to beyondwellnessradio.com where you can access our full podcast transcriptions. While you're there, you can also sign up for our thyroid and female hormone video series. This series goes into the root cause of why your hormones are out of balance. While you're there, you can also schedule a functional medicine consult with Dr. Justin, myself, where we'll dig deeper into the root cause of your health challenges. Feel free and think of sharing this podcast with at least one person. This podcast grows by people sharing it. Sharing is caring. If you can think of one person that can benefit from this information, please feel free and share it. If you're enjoying the podcast, make sure you subscribe on iTunes. You can also click below the video or podcast where you'll see the iTunes review button and leave us a review. You can also sign up for the newsletter at beyondwellnessradio.com where you'll get updates before anyone else. Thank you so much and enjoy the show. Hey, Evan, it's Dr. J in the house. How was your weekend, brother?
Weekend was great. Life is good, except for the weather. Rainy, cloudy, cool. Fall is here officially, but what can you do?
Very cool. My wife and I brought our new baby to his first wedding, so that was pretty exciting. First wedding with the newborn was fun, and he did a great job.
Oh, good. Isn't it great when you go out in public and the baby's good? And you're
isn't that great?
Such a relief.
Totally. How's your baby doing?
Oh, she's great. She's got her molars coming in, so she's been very incessantly crying this morning. But wife texted me and said the baby knocked out, so nap time is a good time.
That's great, man. Very cool. Well, we chatted kind of in our early part of the show, talking about what we're going to talk about today, really. And we kind of discussed that dandruff's a big issue that's been coming up in our clinical practice. We wanted to talk about kind of what it is and just some of the clinical strategies that we utilize to approach it and to help address it from a root cause functional medicine perspective.
Yeah, something I think we should hit on first is what's the conventional approaches? Is it dermatologists that people are getting referred to? Like, what's the rabbit hole, would you say, that people end up on with the dandruff problem?
Yeah, so dandruff typically is this excessive shedding of kind of the skin on the scalp, and it tends to be fungal driven. Of course, there are natural diet things that help, right? Good fats, good proteins, like the digestive, the hydration component, all those things are important, but the infection component is really important because you can have the diet stuff all dialed in, and that may not be enough to get rid of that infection component. And sometimes the fungal overgrowth that's there could be there from a deeper infection. It could be there from a H. pylori or a blasto or a deeper parasite infection. So it's important we keep our eye on what could be there in the scalp area, but also what other bigger infections could be promoting that overgrowth.
Yep. So if you go to a conventional doc and you just happen to bring up dandruff, what are they going to do? You think they'll just refer you out to a dermatologist and then they'll give you some steroids for it? Or, I mean, what would the conventional approach be? That way we have something to contrast it to our functional medicine approach.
Yeah, so your conventional approach is going to be Head and Shoulders or Selsun Blue. You know, that's going to be the general conventional approach. They may give you a systemic antifungal medication if they see other kinds of things happening there. That's going to be the general consensus.
Yeah.
Now, the first thing that we're going to look at is we would probably lean more towards a antifungal kind of shampoo that's herbally based, like tea tree or lavender or neem. These are some really good antifungal shampoos that are out. We'll put some in the links below. A couple of the ones that I like are Art Naturals and Purely Northwest. We'll put some links below here so people can access them. I use those in my clinic a lot. You can also just get some pure, apple cider vinegar. You can mix a little bit of coconut oil. You can even do a little bit of tea tree or neem straight and kind of do a little scalp massage and get it right there in the scalp. That can be helpful too. But there's some other shampoos that are out there that are all ready to go. So that's another good option for you, just if you don't want to have to deal with that.
Cool. So let's talk about testing. I mean, this is always our philosophy. You've got to test, don't guess. So if you've got a fungal issue, we talked about parasites. So we want to look into the gut, and then the organic acids testing. Wouldn't you say that'd be an important one for this too?
Yeah, I like the organic acids because you can kind of look at fungus that may be more systemic. So when we look at a gut test, we may see various species of fungus in the gut. We may see Candida, we may see Geotrichum yeast, we may see Cyclospora yeast, we may see other types of Candida species, Rhodotorula, Crucia. These are different species of yeast. And again, yeast is like the big umbrella. I should say fungus is the big umbrella, and then we have some species of yeast that are kind of under that big umbrella of fungus. So fungus is the big umbrella. Yeast is the smaller kind of umbrella. And again, mold, like different molds like that you may see like aflatoxin mold or ochratoxin or trichothecenes. These different compounds are also kind of under that fungus mold umbrella as well, right? Yeah. So getting to your question, those are some of the big ones you may see. Now, the benefit of the organic acid test is we have some markers that are more systemic based. So we have diarabinitol is an interesting marker that looks at fungal overgrowth from a systemic perspective. So sometimes we see people that get these stool tests back and they're maybe okay from a fungal perspective, but when we look at their organic acid urine, we may see that diarabinose on the higher side, which tells us there may be some kind of fungal thing going on at a systemic level. And sometimes we may see it systemically, but not in the gut. So that's a good marker too for treatment.
Yep. Cool. Yeah. So Justin and I, between us both, we've run thousands and thousands and thousands of stool and organic acids testing. I would say, and Justin, tell me if your assumption is different. 9 out of every 10 people have a yeast and or a fungus problem, whether it's to the level it's going to cause extreme issues or not. Maybe it's not 9 out of 10 that have an extreme problem, but somewhere 9 out of 10 times is going to pop up with something that needs to be addressed in that category.
Yeah, 100%. I think there's always some gut component. I would say the majority is a gut component, and most people with a gut component, yeast is going to be present. I find that yeast as the primary issue isn't more common. Is less common, I should say. What's more common is there's a deeper infection, like a parasite or a bacterial infection that's of a higher level, and the yeast is just kind of there. Kind of like you see the shark and then you see these underlings that kind of suck to the shark's belly.
Yep.
Right? They're kind of like that. They're just there as the underling, and you get this bigger, stronger kind of critter that is the primary focus.
Oh, by the way, I don't know if this is true. I heard from a client of mine last week. Supposedly Diagnostic Solutions is coming out with a new panel that can be added to the GI map where we can actually test for worms, including pinworms.
That's awesome. I'm really excited. Worms are definitely a concern. I know we've talked about, we add in wormwood, we add in mimosa pudica, various herbs like that to help with a lot of these worms as well.
Yeah. So if that's true, we're going to have some really good extra clinical nuggets in our hand.
100%.
All right. So I wanted to mention antibiotics as a cause here. So if somebody does have dandruff, and we could also convey that message to other issues with the hair, the skin, the nails, there's probably a history of like a urinary tract infection, right? So like these yeast and fungus that you're talking about, if that's affecting the vaginal area for a female and they get put on some type of natural antifungal or probably a conventional antifungal, that stuff's going to come back with a vengeance. They may end up doing antibiotics therapy too, and that's not good. That's going to create a lot of room for the yeast and fungus to overgrow. Then all of a sudden you've got the cleanup crew that has to come in post antibiotics. So
100%.
We're not big fans. Like if you can avoid antibiotics, if your life is not in danger, then you could probably go ahead and say, skip them and go to the natural remedies instead.
100%. So of course, the big thing when we deal with any type of fungus is really cutting out refined sugar. So if we look at our carbohydrates and we kind of draw a line down the middle, we have like real food carbohydrates on one side of the fence, and then we have refined sugar carbohydrate where there's actual added sugar to the carbs on the other side. So basically draw that line. Anything that's refined sugar we throw out. And then on the left side, I kind of break it down into starchy, non-starchy. Okay, so starchy being like sweet potatoes, squash, white potatoes. Non-starchy being our veggies, broccoli, Brussels sprouts, cauliflower, kale. Those are our non-starchy. And then we have basically our high sugar fruit and our low sugar fruit. High sugar fruits are going to be more tropical things, bananas, pineapples, mangoes, right? Those kind of things. And then we have our lower sugar fruits, berries, green apple, grapefruit, passion fruit, those kind of things. So we try to, number one, stay on the non-starchy carbs primarily and the low sugar fruits. So typically 1 to 2 servings a day, even on an antifungal approach, is going to be okay. Some people, they go to the excessive and cut everything out, but there's some clinical evidence that these fungal critters may go into the spore-like state where they're now kind of in hibernation mode, and it may make it harder to kill them. So we'll actually have 1 to 2 servings of fruit in there. We may even actually up the carbs even more during the killing to bait them out. We want to wake up that bear so it's not hiding in its cave all winter, so we can hunt them down, so to speak.
That's a great point. So if a ketogenic diet has been the norm for someone, we may need to bump up carbs a bit and maybe add a little bit of fruit back in. There's been a lot of demonizing of fruit lately, which I'm just not really a fan of that. I think there's a lot of value there.
And again, it's all individual. If you're super overweight and you have a lot of markers for insulin resistance, your waist size is greater than 40 inches for a male, you're upwards of 20 pounds too much weight on there, then that may make more sense to limit it, or at least focus on the lower glycemic, low sugar variety, right? Low fructose variety, maybe keep that fructose below 15 grams a day. That makes sense. But if you're pretty active and you're pretty healthy weight, I'm fine with a couple handfuls of that a day. That's not a problem.
Yep, good. So you mentioned the diet piece. Now, some talk about diet as if it could cure you of these problems. I mean, I don't really agree there, where if you just follow this candida diet, all of a sudden your problems are going to go away.
I think if someone is like, they're kind of like dipping their toe in the functional medicine field, like, is this worth it? Well, just start with the diet stuff and see how much you get accomplished with that. If someone's having a lot of refined sugar and a lot of refined carbohydrate, right? Remember that line I drew? Refined carbs and then whole food carbs. If they're having a lot on this side and they cut that out, they may see a significant improvement, which is great. And they may cut the grains out as well, which is great. But they may be that last 20 or 30%, or if there's a deeper infection, that will have to be removed as well. So if it's just purely a fungal overgrowth, you may see a good improvement, but there may be some stuff still lingering. And if that's the case, then we got to dig deeper, put on our clinical hats, and you want to definitely reach out to someone like myself or you, Evan.
Yeah, well said. Yeah, I guess my point, I wasn't trying to bash the diet piece. I guess my point is that a lot of people sell these books promoting certain diets as if you can magically eradicate all of your gut problems. For me, I got maybe 80% better. So I dealt with IBS for probably 10 years, maybe even 15 years. I mean, I had always had irritable bowel problems. Once my diet was better, my gut problems were there. But then when you first took a look at me, you said, Evan, you've got parasites. And that's something that no matter how much kale and broccoli I ate, I wasn't going to get rid of parasites.
Or grass-fed meat, or exactly. I get that. So we're kind of biased because we see a lot of people that already come to us, they got their diet on track, and we got to dig deeper on top of that. So I get where you're coming from for sure.
Yeah, but the low-hanging fruit, that is the diet. And then we Justin and I often have people that come to us that have been doing like a paleo template or even like an autoimmune paleo, and they're still sick. And that's where we say, okay, good. You've got the diet in place. It has to be in place. Perfect. Now let's dig deeper. And that's where we're going to find this other stuff.
100%. So we hit the fungal component of dandruff. We talked about the excessive shedding of the skin on the scalp. Again, a lot of babies have it. It's called cradle cap or seborrheic dermatitis, tends to be fungal based. Again, with my kiddo, we're really just giving just real good quality breast milk, but also what the mom eats has a huge effect on the breast milk. So my wife has kind of a good paleo template, really on point. We give our kid probiotics as well. He gets the Infantis strain of probiotic. I know your daughter did the same thing as well, which helps a lot too. And surprisingly, our baby's had, zero acid reflux, zero spit up. So I think that's really made a big difference as well.
Oh, that's awesome. Yeah. So moms listening, this could apply to babies too. We got to fix your diet as well. If you've got a yeast or fungus. Now, do you have any evidence on this? Like someone, like a mom passing a yeast or a fungus overgrowth to the baby via breast milk? I've heard that with Lyme disease and co-infections, these spirochetes can pass through the breast milk, but I just wonder about, the yeast. Could you pass a yeast through the breast milk?
Well, that may or may not be the case. I'm not really sure. There may be some data on that. My biggest concern is a lot of the infants that are going to be fed formula. If you look at a lot of the ingredients, it's about 50% high fructose corn syrup.
Oh, God.
So if you look at the amount of sugar that's in a lot of these formulas, it's the same amount that's in a Coke.
Yeah.
So we just got to be careful because that's not really the best thing for your child. And then a lot of it's going to be GMO too. And there's some evidence of mercury getting into a lot of these high fructose
compounds due to the extraction process. So that's not good either.
Wow. So I've talked with a couple practitioners who do like a microscope where they look at the blood and they seen little balls of yeast basically in the serum of the blood. So I just wonder, wonder if any of that actually gets into the system where a mom can pass it to the baby or not. We'll have to keep asking, keep digging. That's just for my curiosity, but
I think that's a really great question here. And I think clinically it makes sense because I see a lot of women that have poor gut issues and their child can get it. They'll get thrush with that white coating, so to speak, and they'll get kind of a yeast issue, or they'll get a lot of kind of diaper rash stuff. And that can happen as well. Like with our child, we've had no real yeast issues, not even any diaper rash. We just kind of like a couple times a day, my wife will put like a little bit of coconut oil there. We have some natural stuff that we put there. But outside of that, I mean, he's, my son Aiden's been doing great on that side of the fence.
That's great. All right. So we hit the diet piece. We talked about antibiotics as a potential problem leading up to this. I would say birth control pills could be a factor too. I've had a lot of women. I don't know the exact correlation or causation. I don't know if that's doing something with progesterone and estrogen that's causing the dandruff or what it is. Do you have a take on that of why birth control pills could be a factor?
Yeah, birth control pills have an effect of alkalizing. So it can alkalize the urinary tract. It has effect on alkalizing the gut. And fungus likes to be more in an alkaline environment. I know everyone's like alkalize or die, right? Well, a lot of these bacteria, and I should say more funguses and bacteria, they like more alkaline environments. If you look at what probiotics do, probiotics actually add acidic load to the intestines. Like if you look at acidophilus, it literally translates to acid loving or acid producing. If you look at a lot of the really good fermentable drinks, a lot of them are very high in various acids, whether it's glucuronic acid or
what is it? Acetic acid?
Acetic acid, which is the main acid in apple cider vinegar. And it's not a surprise that acids like apple cider vinegar are used to treat fungal issues in the hair, or they're used to treat UTI issues as well. People will then utilize the apple cider vinegar before a meal to help with digestion and also acidify the urinary tract too. So a lot of these things are very helpful to decrease the critters, and it just changes the environment in the gut. So good probiotics actually spit out more CO2, right? They spit out more of these really good acids to help get the gut into an environment pH-wise where these critters can't thrive, so to speak.
Okay, got it. Yeah, so birth control pills, the antibiotics, maybe the prescription diflucans or other prescription antifungals that you could have been on before, making these strains more resistant. We talked about the sugar in the diet. We talked about the gut infections, looking into those for bacteria, yeast, fungus, parasites, getting your gut checked with functional testing, not conventional testing. We talked about getting the urine organic acids for looking into the yeast and measuring it that way, because the stool test often gives us a false negative.
And we may even look at blood too. We may look at candida antibodies like IgA, IgG, IgM, and we may see those on the higher side, which could just mean there's more of a systemic issue. And if we know that, it's nice to know, because if we don't have any gut stuff going on, or we don't even see any organic acid stuff, typically you'll see some organic acid. You'll see the D-arabinose there.
Yeah.
But if not, we can always run the blood antibodies too, which is nice.
So what do you say to the person when they say, "Oh, Justin, can I just go buy a bunch of herbs and just start randomly throwing stuff from the kitchen sink at this problem and see if it works?"
Well, the bigger issue is most people that have these symptoms, they have a whole bunch of other things too. It's very rare that you're like, "Oh, my only chief issue is dandruff or some kind of fungal issue," right? It's mood, energy, sleep. If you're a female, there's probably some cycle imbalances, whether it's menstruation issues or mood issues or breast tenderness, back pain, whatever is happening there. And then you have this. So there's a constellation of different things happening, and body systems, they function and dysfunction together. So imagine a beautiful orchestra going, right? And one instrument starts going off. Let's call that one instrument our fungal overgrowth, or our scalp kind of dandruff issue, right? That's our one symptom. That's our one imbalance. Well, it doesn't take long before the rest of the orchestra starts singing out of tune as well. And that's kind of what I'm referring to when we talk about the other hormonal issues that go out of balance. And then when we start having gut issues, then we can start having more leaky gut, which then can create more immune stress. And then we can have more malabsorption and low stomach acid and enzymes and nutrient deficiencies, which then affect neurotransmitters and other hormone pathways. So you can see how this thing can really spiral out of control pretty fast. So that's why it's good to always dig in deeper to really get a good body system audit of all the other things that are happening.
Yep, well said. I'm so glad you said it so eloquently. I did a rant at the end of my podcast that I put up last week, and I just told people, I'm like, look, please don't wait till you hit rock bottom. Don't wait until every body system is falling apart and then you reach out. Like, you and I work with those complex cases all the time, but if you've got one thing, like it's anxiety or a little bit of depression or a little bit of gut issues or a little bit of skin issues, it's so much better to start getting tested and start digging deep then, as opposed to waiting until your symptom list is 20 pages long, you've been suffering for 20 years, then you hit rock bottom, then you decide you want to get better. I'll tell you, it'll save people a lot of money and a lot of suffering. If once you see these problems, the little tip of the iceberg poking out, address it then. Don't wait until, like you said, you've got anxiety, depression, PMS, irritability, mood swings, rage, poor sleep, and dandruff to top it all off. It's
100%.
Just, please. And that's not even to benefit us. That's to benefit you. You know, we've been so booked up that we aren't necessarily begging you, hey, please come see us. It's not like that. It's the fact that, hey, look, I just want to save you some suffering and save you some time. Justin and I came from our own health journeys as well. And if we could just give you one piece of advice, and maybe I'm not speaking for him, so I'll let Justin give his feedback too. But if I could say one thing, it would be, if you've got a weird symptom, there's probably some other stuff going on that you just have to find and fix.
100%.
Like me, I had to wait until I had lost about 25 pounds. I had terrible sleep. I woke up, I wasn't feeling rested. I had a lot of stress. I had some anxiety problems, even to the point of a panic attack. I called Justin up one day. I was like, man, my heart's beating out of my chest. I can't stop my heart. You're like, well, how much stress do you got going on? I was like, a lot. And then he's like, well, how are you sleeping? I'm like, haven't been sleeping very well. And then he's like, what's going on with your gut? And I was like, oh my Lord, every body system is affected. My gut's been affected. Yep. My brain, my stress response is broken. I was like, this ain't even me. I'm not even an anxious person. What's going on? And you go, oh, it's parasites, Evan. So for me, I had to learn the hard way. I had to wait until my symptoms piled up so much that I was falling apart to then fix it.
100% agree. I think we're at the point in our careers where we realize that there's probably more people out there that we see online with the millions of downloads we get every few months, that we're not going to be able to help everyone, so to speak. And there's just too many people out there to help, that we really want to put as much free content out there. And if we can just get most of the people to just apply the free stuff, that is going to be huge. And then we're going to make a huge difference in the world just by itself. So I think we're really just getting really good actionable information. And I think the key thing I want to push to everyone listening, if you can walk away with just one action item, hey, I'm going to do this, or I'm going to add this component, or I'm going to add this diet shift, or this lifestyle change, or this supplement change, I think that you're going to make yourself better and healthier after every podcast.
Agreed. Cool. Do you want to hit some questions for a few minutes?
Let's grab some questions.
Okay, cool.
Then just a little feedback.
Yeah.
Everyone writing questions, if you can kind of keep the questions framed towards the conversation, I mean, you can kind of do a little politician pivot where you're like, hey, dandruff, and then you're on adrenals, right? We could kind of do that, so to speak, but just try to keep it connected to what we're talking about as possible. If it's so disconnected, we're just going to have to skip over the question.
Yep. Well said. Okay. Yeah. So a lot of those were like off subject questions. Let's see.
I got one here about, let me see here. I got Gerald's question here. Gerald was on my GI Clear 2, positive for H. pylori. I feel like it's returned. If I add Mastica to the GI Clear 2, what dose should I take per day? Typically 2 caps TID, 2 caps 3 times a day, and we need to retest, Gerald. Make sure the infection's gone. Make sure there's no residual infections. And we want to look a little bit deeper too at your partner or any dogs or pets in the house. Partner for sure is the easy one, because that can, you can go get that reinfected back and forth. So we may need to retest and then do the GI Clear 2 and the pure Mastica 2 caps TID and get that retested.
Well said. Yeah, I had that a few weeks ago. A lady, she said, I feel like my guts backtracked after I got off your herbs. What's going on? And I said, well, now it's time to test your partner. And sure enough, there's the H. pylori. That's why she's been getting reinfected. It took 3 rounds to get rid of it.
Totally.
That's crazy. All right, let's go over to the next one here. There was one from Avi. We'll call it Avi. I don't know how to pronounce that full name. Any tips on reducing hair loss and thrush when coming off of HRT as a female?
So that would be helpful to know. I mean, I imagine, I'm just kind of guessing this is menopausal female. Okay. So, 53, 54 and up. So depending on kind of where the hormonal imbalance is, it'd be good to know if there's an estrogen dominance present or if we're just having low estrogen and low progesterone and everything's kind of in the tank. So typically when I think hair loss, though, I'm leaning more on the thyroid side. So I'd want to know where the female hormones are at, if you're cycling or not. So if you want to comment on that, that'd be helpful. Number two, really looking at the thyroid component, because the thyroid has a huge effect on the hair follicle, stimulating the hair follicle to grow. And then number three is the gut component, because that's where we digest and break down a lot of the nutrients and amino acids and fatty acids that become the building blocks for our hair. So I want to look at those three places first.
Well said. So I'd also add on looking at ferritin levels too.
Yep.
See if there's some type of anemia problem. You hit the thyroid. So in the thyroid.
And when I say thyroid, though, that includes all that constellation, because iron is very important for making thyroid hormones. So if we have a history, if it's menopausal female and she's not vegetarian or vegan and doesn't have a history of endometriosis or fibroids or excessive menses, it's probably not an iron issue.
Good. And then when you talk about the thyroids too, so this is also including the antibodies. So making sure that there's no Hashimoto's at play, because we see that a lot. Justin and I find that many people with autoimmune thyroid, the hair, like 9 times out of 10, it's a problem.
Yep, exactly. And we'll add in collagen peptides too, just because collagen is it's just great. It's a great building block. And then if it's in peptide form, it's already super easy to digest. So give a little plug for my True Collagen on that one.
Yeah, check it out. All right, Gerald had a follow-up question. For second round of H. pylori eradication, should it be a 30-day protocol or 60 days?
Yeah, typically a minimum 30. You can't go wrong with just doing a 30. It just depends on what other infections were present along with that. But if it's just the H. pylori, I'd say 30 to 45 is typically good.
Yep, nice. All right, Massimo had a question here. Are sustained release essential oils and herbs necessary as opposed to the liquid oil taken internally? It's kind of a confusing question. I didn't know there was such thing as a sustained release essential oil, but what we're talking about for this conversation would have been like a topical. So like Justin mentioned about those brands of the tea tree oil shampoos and such, that would just be a couple of drops on the scalp. Use some type of jojoba or avocado or coconut oil and try to dilute that so it doesn't burn your scalp.
Totally. In my line, we have GI Clear 5, which is an emulsified oil of oregano that is more enterically coated. So it does open up more in the small intestine than the stomach, because a lot of the fungal issues tend to be more in the stomach. I'm sorry.
Oh, yeah.
First, that tend to be more in the small intestine. H. pylori more in the stomach.
Yeah, I forgot about the oregano oils. I guess when I read essential oils, I was thinking just like your standard oils that you diffuse.
And that's why I like to have some of my, oils or some of my herbs taken on an empty stomach, just so it can get fully out of the stomach into the small intestine where it can really help. It can be a little bit more effective.
Yeah. All right. So Samuel had a question. What's your take on taking CBD with no THC for inflammation? I took it for the first time and noticed a huge difference in relaxation. I'll hit this one. I'm a huge fan. I just posted a YouTube video. If you haven't checked it out, look it up, Samuel. I went to a hemp farm here in Kentucky, one of the very few hemp programs that's been approved by the state government. And the guy's making super high quality CBD. And the guy, so he used it on his son, who was having hundreds of seizures per month. And now the kid is like 12 years old and hasn't had seizures in years, just from CBD, no THC. I think the THC does have benefit. I hope that there's a couple of bills that are trying to get through for 2018. I hope we can federally just decriminalize cannabis across the board, because I have talked with people, especially in the pain department, where when they add a little bit of THC in, all of a sudden their fibromyalgia or their chronic pain does get better, which isn't achieved just by the CBD by itself. So I think both would be awesome. Yeah.
I'm not a huge fan of the THC side. I think it can have some really good benefits if you're going through cancer treatment and have extreme nausea and or extreme pain and the CBD is not helping enough. I think it can be helpful. Like if we're choosing, THC over a chronic dose of a pain medication or opiate or like a lot of ibuprofen, I will definitely reach for the THC component, over the rest. My biggest thing is just, number one, there's some potential memory side effects, cognitive side effects. Number two, I would say making sure that you're not having to incinerate it every time, right? Trying to do a vaporizer or some kind of other medium that's not involving the incineration, which exposes the polyaromatic hydrocarbons and the heterocyclic amines. These are the carcinogens that are produced. And the CBD obviously is better just because it's less psychoactive. But if you can, epileptic stuff, autoimmune stuff, anxiety, mood stuff, CBD for sure THC more on the, if the CBD is not working and you need the pain, or you have a lot of the nausea stuff, that may be better.
Yep. Yeah. I mean, with the THC, I'm sure there's tons of people that still combust, but you really don't even have to anymore. There's so many different drops and tinctures and potions and such that you don't have to burn. You don't have to burn the herbs anymore. And people don't want to get high too. So you could do like a 20% CBD, like a 1% THC, and you'd probably feel really good.
Yeah, I hate the feeling of being high. I've only done it a few times in my life, but I'm tired and I just get the munchies. It's just like I'm fatigued and I just get really hungry. It's like I don't need that. Like I want to be energized and alert. And I think a lot of the negative studies on marijuana too is, number one, you really have to make sure you're not getting pesticide exposure.
Exactly.
And you have to kind of ferret out the burning and the incineration of the leaf. I think if you take those two components out, I think you'll see a lot of those confounding variables showing negative results and those studies improve.
For me, a vaporizer changed my life. When I had IBS, the only thing before I knew about diet changes that helped me was a vaporizer. It would slow down my bowels since I was having so much loose stool. It would regulate the bowels better. Stomach cramps, stomach pains would go away. So I had a lot of hands-on experience. Super helpful. I don't vape anymore though.
And I think, go ahead. I'm sorry.
I was just gonna say, I don't vape anymore currently. One is it's impossible to find a good source in Kentucky. Now, if I go to Colorado and I could find some good organic, high quality, I'm gonna take a sample. That's for sure. But for me, I can't find a good source here. So I do stick with the CBD drops, which is legal too. You know, it's another thing. It's legal in all 50 states. The CBD is.
Totally. And just kind of hitting it, I think a lot of marijuana, maybe not the CBD because that's more the non-psychoactive. I think a lot of marijuana is used, to cover up emotional stress, to kind of numb yourself out from whatever's happening in your life. So we just got to make sure that you're not using it to avoid reality, so to speak. But there's a lot of drugs out there that are very dangerous and have a lot of side effects and kill a lot of people. So if we're choosing marijuana or over these drugs that kill a lot, I will always choose the drug that doesn't have the profile of killing people, right?
I'll pick it over alcohol too. If I had somebody say I want to drink a bottle of wine every night or hit the vaporizer or do a couple of drops of a tincture, the alcohol for me is going to be a bigger problem because it's going to create the leaky gut situation.
Yeah, I mean, if you're drinking excessively, if you're having a glass or two and it's organic, hey, I would, you're probably fine with that on the alcohol side. But if you're going, 4 glasses a night and then it's consistent, they've done studies. I think it was the Giuliani report. They looked at like the highest ranked college students in the country and they said, what do you prefer, alcohol or marijuana as your drug of choice? And the kids that had the highest grades were choosing the marijuana, and their main reason was because of the hangover. They could wake up the next day and study and get their work done.
Makes sense. So, all right, let's see if we have any other on-topic questions here. Do you see any others?
See if we can find some things that we can connect to our little politician sidestep here.
Gerald had one about how do you know if you're eating too many starchy carbs per week? I cycle, like it depends on the week and depends on activity level, how much I'm going to do. What's your take?
I think 50 to 150 is a pretty good place for most people to be. And if you're doing a lot of lifting or a lot of CrossFit, then you may need to go up to 250. So I think look at your height and weight. If you're at a really good height and weight, you're going to have more latitude. If you're lifting a lot of weights, I think you can go up to 150 to 200. If you're doing Ironmans or like, those, then you may have to go way higher than that. So I think you really got to just figure out where your activity level's at, figure out where your height and weight is right now. 50 to 150 is pretty good. And you earn your carbs, so you exercise more, and you're lifting more weights. You can up the carbs a little more and just try to keep it whole food, and you're going to be fine.
Here's another question about glutamine. Should you take glutamine by itself to repair leaky gut, or is it okay to combine with protein?
I mean, glutamine is an amino acid, but if you mean like glutamine and then have real whole food protein, that's fine. I mean, in my line, we use the GI Restore, which has L-glutamine and a bunch of other healing things, N-acetylglucosamine, and we'll mix that in a drink, take it on an empty stomach, and then patients will still have, a really good whole foods meal, or we'll add in the collagen as well, which is very high in glycine, and glycine is really good for the enterocyte healing as well. So you can do either the L-glutamine. I'll typically only do L-glutamine by itself for patients that are very, very sensitive. We'll typically add the healing compound in there, the GI Restore, all the other, deglycerized licorice, aloe, slippery elm, N-acetylglucosamine, right? modified citrus pectin. We'll add all those in together. And if that's causing too much sensitivity, then we will do L-glutamine by itself, but they got to really be sensitive if that's the case.
Yeah, and I find that pretty rare. The glutamine by itself, to me, it just doesn't move the needle as quick as the combo products like you talk about.
Yeah, only if there's an allergy issue. And then the collagen's great because glycine's a really big, building block for healthy gut function too.
Nice. Bone broth too. I think that's another worth.
Well, that's very high in glycine too. Yep.
Cool. All right. I think that was it. I mean, there were a bunch of other questions, but a lot of these were super off subject, so I don't want to distract from the convo too much.
Yeah. So
any others?
I think we kind of hit everything. I don't want to go off too on the kind of the deep end. James here talks about just kind of the cost regarding the organic acid test and keeping it low. Typically, if you're trying to keep the cost down with the organics, just do the test once a year. Do it once a year. Ideally, if you can do it twice a year, that's ideal. But if not, you can just do it once a year. That's kind of your best bet, and kind of just fine tune your program once a year with the organics. That's probably the best way to make it more cost effective.
Yep. Well said. Gerald said that we guys are the best. Changed his life. Hey, Gerald. Thanks. We appreciate it.
Yeah. Gerald's actually a patient. I'm glad we could help, Gerald. That's very good. And then one last question too. Diana talks about doing a podcast on estrogen dominance and progesterone therapy. Hey, you're kind of a year too late. Check out the podcast show notes. We did a podcast on estrogen dominance, and we talked about progesterone and our cyclical augmentation programs that we'll do with progesterone therapy too. So check out that podcast, Diana.
Yeah, go on Justin's YouTube. That's probably the best if it's posted there, or just check out his site, Justin Health, and then just type in estrogen. You should find it either way.
And if you guys enjoy this right now, the best way you can thank us, give us a thumbs up, post share on your Twitter and or Facebook. We love it. We just want to help more people. And you notice there's a lot of people that are out there, podcast people, they either hold information back or all they do is spend 90% of their time promoting their products and affiliates. I'd say 95% of our time is just free intel. Of course, we got a little plug here and there, but we're 95% free information because we know there's too many people out there that need all this info, and we're just going to just be an open book to everyone.
Yep, totally. So we hope it helps. And if you need to reach out, schedule a consult with either of us. For Justin, check out his site, justinhealth.com. You can look up and click the book an appointment button. Myself, same thing, evanbrand.com. Check us out, stalk us, study us, look under every crevice and corner, read our reviews. We're here for you. We're happy to help if you've got this issue going on.
Leave us comments below. Tell us what you liked about the podcast and tell us about future podcasts that you want to hear. We're reading them and we get inspired by those comments below. So say, hey, I like this about this podcast and I want to hear something about, and tell us that topic and we'll add it to the queue.
Yes, sir.
Awesome.
Good chatting with you.
Everyone have a great day. Take care.
Take care.
Bye.
Got a question for Dr. J? Go to beyondwellnessradio.com and click the questions button. Then tune in to hear the answer. Also, if you like the show, click below to review us on iTunes. For more Beyond Wellness Radio, go to beyondwellnessradio.com.